Welcome to the page on COPD, chronic obstructive pulmonary disease, chronic bronchitis, emphysema. My name is Dr. Shafiq Qaadri. What actually is COPD, or chronic obstructive pulmonary disease? Well, it's a very important breathing disorder. Basically, usually because of lifelong, dedicated, and unrepentant smoking, your lungs end up burned up, dried, and scarred. That's what makes it so difficult to breathe. When you look with a microscope, for example, at the lungs, the lung tissue looks like a city that's been bombed. It literally looks like a burnt-out shell of a formerly thriving metropolis. Along with cigarette smoke, other lung irritants, such as pollution, dust, smog, and industrial chemicals, can also be very important. COPD is a very important and common cause of disability and death, and unfortunately, it's getting more and more common as our population ages. Symptoms: what you experience with COPD. COPD symptoms include cough, often severe and ongoing, shortness of breath, phlegm or crud production in the lungs, wheezing. The cough in COPD is especially deep and pronounced. That's why it can be known as a smoker's cough, often very bad in the morning. Some patients even find it difficult to talk or to catch their breath even after mild activity. Patients with COPD can often have attacks of shortness of breath and coughing, and often have to go to emergency departments because of significant lung infections or flare-ups. In fact, chest infections in COPD patients can last for several weeks instead of just a few days. We should also remember that it's never too late to quit smoking, although, of course, the earlier you quit, the better. COPD treatment recommendations. What medications you need depend on, of course, how bad your COPD is. Some people are breathless only with exercise. Others feel too breathless even to leave the house. To help decide how bad your COPD is, we doctors use a breathing test machine called spirometry. This actually measures how well you breathe. Based on all these tests and your own history, we decide what's the best combination of medications and interventions. Use puffers the right way. It's important that not only patients be given the puffers that are right for them, but you also be taught how to use the puffers correctly. This is one of the big challenges that doctors face. We prescribe the right medication, but people aren't very skilled at using the puffers and various devices. It's important for a doctor to watch how you use your puffers every so often, as there are always suggestions and ways to improve. Treatment goals for COPD. Treatment goals are focused on relieving symptoms, improving exercise tolerance, improving your health, and restoring your quality of life. Quitting smoking, of course, is an important part of this. Getting an annual flu shot can help protect at-risk patients from getting seriously ill. Some patients benefit from pulmonary rehabilitation, sort of like aerobics for your lungs. Some will need home oxygen, but most people can do well with the prescription medications. So take this message to heart and protect your lungs.